There are 1.2 million Rotarians in the world, and there are two things that link us all: service above self and the eradication of polio. This afternoon, I'm going to do a quick 20-minute primer, firstly on polio, and secondly on what it's actually like to take part in a polio eradication campaign, a NID, in India. Firstly, moving on to polio itself. What is polio? Polio is a virus. It destroys nerve cells. It spreads primarily through fecal matter. It's very, very easily transmitted. It can be fatal. It can cause disability. And many years later, people who've caught polio and have recovered from it in their youth develop post-polio syndrome. Polio is a very, very old illness. 3,000 years ago, about 1000 BC, there was an Egyptian named Ruma, and on the screen you can see a stele, which is a carved piece of stone about this high, of Ruma, who is giving a libation to the gods, either thanking them for not killing him off with polio, or thanking them for sparing him anything worse. And he's thought to have polio because he's got a withered leg and he's standing with a stick. Running forward 3,000 years to the year 1950, which is the year when at least one person in this room was born, there were 7,700... All right, good, well done, you've done your homework. There were 7,760 cases of polio in England. Now, I'm talking about England, not England, Scotland, Wales, Northern Ireland, the rest of the world. 7,760 cases of polio in England. And 10% of those cases were fatal. Also in the 1950s, we had two vaccines being developed. The inactivated vaccine being developed by Salk, and the live vaccine, which is the one we use in NIDS, being developed by Sabin. And in 1955, vaccination started in the UK. Now, I expect many people here can remember not being allowed to go swimming in the local Lido during the summer. Such was the fear our parents had of us catching polio. It was a terrible threat to us. I can also remember having my first polio vaccination. When I was about 8, I remember being taken to the health centre by my mother and being vaccinated against polio. And that's when the risk of polio started to decline. But 1984, the last case of polio in the UK, and 2002, Europe as a region was declared polio-free. Rotary's involvement in polio started in 1979, when there was a pilot immunisation program in Manila. Polio epidemics were rife in the area, and a Rotary club said, let's have a go at trying this new vaccine in Manila. Nobody else is going to pay for it. We'll find the money, and we'll do it ourselves. 1985, Rotary, that's us, the 1.2 million of us, said, let's eradicate polio throughout the world. Nobody else is doing it. We, as the organisation we are, will take on the eradication of polio. And that's when our Polio Plus Global Challenge started. 1988, 3 years later, 3 years after we've decided we're going to eradicate polio in the World Health Organization and others resolved to eliminate polio throughout the world and to join in with us. And in 1985, round about 350,000 cases of polio worldwide. Roll forward, last year, 2017, 22 cases of polio worldwide. Why? Because of us, because of you, because of our Contribution Foundation, because we came up with the idea in 1979, really rolled out globally in 1985, we were going to eradicate polio. And around about 2.5 billion children have been vaccinated because of us. And Rotary and the Gates Foundation, we must always remember our gratitude to the Gates Foundation, have raised $1.7 billion of the $10 billion that have been spent on the eradication of polio. I'm here to talk about India. So polio immunisation in India started in 1995, National Immunisation Days. By National Immunisation Day, all children, 174 million children, the number rises every year, but think of 174 million, are going to be vaccinated in one day throughout the whole of India. And to do that, we're going to need 2.5 million vaccinators, and in the week after, we're going to visit every single house in India that is thought to have children visiting them. living in them, and we're also going to go everywhere else we know there are children, because they don't all live in houses. Now, when I first heard about that, going to vaccinate 174 million in one day, I thought, come off it, that's India. You're not going to be able to do it in India in one day, not even in 1 week, or even in 1 month, or even ever. But I have to say, they do it. It's an astonishing event, an astonishing organisation, and it has Rotary at its origins. And India, as a result, was declared polio-free in 2014. So if they're polio-free, why do they still vaccinate? Well, the map that you can see on the screen shows where polio cases were in 2017 and the previous year in 2016, the blue dots. And they're on the borders of India in Pakistan and Afghanistan. They also vaccinate because of this reason. When I was out vaccinating one day in one of the villages, this child comes down and sits next to me, pulls her pants down, and does a poo right in front of my feet. Over 60% of Indians don't use conventional toilets. They do it in the drains, they do it in the fields, they do it wherever they can. Where does that poo go? It goes into the sewer. The sewer goes into a larger sewer. And where does that go to? It goes into the pond in the village. Where do children go swimming on a hot day? What are they swimming in? They're swimming in the results of the fecal matter, which we know contains the polio virus that goes into the sewer system and goes into the ponds. So unless we keep vaccinating, there is this tremendous risk that polio will come back as the terrible disease it is. Over the past 12 years, about 500 Rotarians from across the UK have gone out to India to take part in NIDS. And you can see some of them over there dressed in yellow. Could you just stand up and wave to everybody? These are our representatives out in India. You're allowed to applaud them for what they've done. And you can see we all dress in yellow when we're vaccinating, partly because it's a very easy to see colour, and you'll see another reason for this in a minute, but also from a safety region we can see each other. And that's about 6,000 volunteer days, and it's all done at our own expense. So when I go out to India with my wife, I reckon on spending about £1,300 on airfares, hotel expenses. We pay our own costs to go out to India to take part in immunisation days. And the total bill, roughly, for all of the past NIDS that we've gone to, is about £2 million that we as Rotarians have spent in order to eliminate polio. And the reason that we've gone there are these two. We owe a tremendous debt of gratitude to Mike on the right-hand side of the screen, Mike on the left-hand side of the screen, sorry, Mike, who remains calm despite all the emails he gets from us, and Bernice, whose skills at telling tuk-tuk drivers they are not going to charge us more than 100 rupees are absolutely legendary. So thank you, Mike and Bernice, on this from us all. And without those two, we would not have been going to India to take part in immunisation days. We go to high-risk areas. By high-risk areas for polio, I mean the areas with a very high transit population, very, very bad sanitation areas, an illiterate population, very poorly educated population, very, very crowded. And you can see the general swathe running down the country from Amritsar in the top left down to Kolkata in the bottom right. Some of them get visits from us from more than 1 year, others are only visited once. And the usual plan is that we have a briefing, first of all, in Delhi, that we disperse. We then go on awareness raising on the Saturday. Sunday is vaccination day. Monday, we start house-to-house checking. And then eventually we come back home. Awareness raising is an essential part of the process. The people we're talking to don't necessarily have access to radios and televisions, so we put big yellow banners, as in this type yellow, across the street saying what the date is and showing the symbol of polio vaccination, which is a child with their mouth open and a couple of drops going in. We also have big banners like this for those that are able to read, and also the organisations there like to ensure they're doing that. Film stars take part in the polio process, and this is a film star saying it's just 2 drops will immunise your child against polio. I should also have to say he uses exactly the same poster to say it's only 2 rupees per phone call, but he probably gets paid for that one, but he's 2 behind the elimination of polio. And then we move on to making a lot of noise out in the streets if we can. And at this stage, there's supposed to be a soundtrack, which they haven't faded up, but never mind. We walk down the street. So that soundtrack is telling everybody that there's polio immunization tomorrow, and you can see we've got a very, very modern loudspeaker on a tricycle in front. Creating as much chaos as we possibly can. We have banners with us. We try and block the road, shouting out polio. They can see us in yellow. They know what's coming. Ride ceremonial wedding horses. And we also go into the slum areas themselves, talking to them about polio the next day. And here you can see the president of the Rotary Club, together with my wife holding the loudspeaker. And we involve interactors because they're very, very good interactors and Rotaractors at helping us get hold of children. And previous polio victims, someone saying, you know, basically, unless you want your child to land up like me, make sure your child is vaccinated against polio. To vaccinate against polio, we need polio vaccine. And this is a vial of live polio vaccine. It's about this tall. It contains enough vaccine to vaccine 20 children. Each child aged 0 to 5 gets 2 drops. It costs about 7p per child, or a large Mars bar for a complete vial of polio vaccine. Think of that, one Mars bar equals 20 children protected against polio. If ever you need the message to use to sell that to other children, that's one they understand. The polio vaccine has to be kept at a cold temperature, so we keep it in cool boxes. And you can then, those of you who've got a polio bear, you can buy some out in the arena hall, being protected by our polio bear. It's kept in the cool boxes in the local hospital. We have indelible marker pens. We mark the little finger of the left hand, hence it's called purple pinky. In case you didn't know where that came from, every child who's vaccinated gets their finger marked. We show that children have been vaccinated by, or record them just by doing a cross in a chart as we're going along. None of this have you got your forms filled in by your parents or your parents with you. We just vaccinate them. If they can't show us the purple finger, they get vaccinated. And then we try and give them a small present as Rotarians. Small present, these are balloons from Poundland, 100 balloons for £1. Just a small token, because they hear there's these strange people dressed in yellow. Let's nip down there, get a balloon off them, and they find themselves vaccinated at the same time. The vaccine is carried out by health workers or by Rotarians, and here you've got one leaving the hospital with a call box over their shoulder, or it's taken out on a motorbike. Again, it's driven by the versatile polio teddy, which you can get over there, only £10, take back to your club. You have to get the vaccine out. You can't leave it out there. It decays if it's allowed to get warm. And we have to get to the people where they live. So they might be living in a village, such as you've got on the left, or they might be up on the first floor, up some ladders. We have to climb up the ladders and vaccinate them. What we'd like to do, however, is get them out to the polio booths, which we may have set up in the streets. And the fact that we are there means they're likely to come and be vaccinating. Vaccinating is a 3-person job, ideally one person to hold the child and get the mouth open. They're not always that cooperative. Another person to put the vaccine drops in. And here you can see my wife doing that. It's her 44th wedding anniversary today, by the way. So mine as well, but I just thought I'd mention that one. And then someone else there who's going to mark the finger with the purple dye. We also adopt the Pied Piper of Hamelin approach. Go out into the houses, into the blocks of flats, find children, lead them down with you to the street where there are Rotarians standing with polio vaccine about to vaccinate anybody who can't prove that they've got the purple finger. Very, very effective, this particular method, swamping the area with Rotarians. Stop the traffic in the street. Here you've got people stopping tuk-tuks. I found if I stand like this in front of a bus, it's got 2 choices. Run me over, and you daren't kill a Rotarian, the gods will be cross, or stop and let us on the bus to check whether the children inside have been vaccinated. If they haven't been vaccinated, then you vaccinate them in situ inside the tuk-tuks. We take no excuses, no purple finger, you get vaccinated. Sometimes they have to be shown what they've got to do, and here you can see someone showing, you open the mouth like that, otherwise this horrible man on the right will force your mouth open so that I can get the vaccine into it. It's a very, very fast process. 100 children an hour is the typical number that we have. We've got 174 million to get through. We've got to go at a fairly fast speed. Monday, house-to-house starts, and here we have 4 health workers that took part in house-to-house this year. Where polio vaccination has changed in India over the past few years is they've got better at doing it themselves and less reliant on Rotarians to help them. The first time I went there, we had to go around doing a lot of house-to-house activity. Now they are trained. Some of them have received grants from Foundation to pay for their equipment and costs, but we now rely very heavily on health workers to do it, and we go to where the people are. So this is a place where women with their children are working, they're washing clothes, they may be living in villages such as that on the left, a slum village, or they may be living alongside the railway tracks. And you can see a Rotarian there standing in the middle of the railway tracks checking children's fingers. It's quite interesting standing in a railway track, hearing a train coming up behind you whilst you're actually doing polio vaccination, but they daren't run over a Rotarian, so we know we're safe. And what we're looking for is the children to do this. You can walk down the street doing this to kids and they wiggle their fingers at you because they know if you don't, they're going to get vaccinated. The problem I have is that when I get home and I'm in Bishop Stortford and I'm walking down the street the week after as I'm doing this to children, they're wondering what I'm up to. But they know what they've got to do. They've got to show their finger. If they have been vaccinated and the house has been checked, we then mark on the door that the house has been checked. And what this sign shows is that it's house 73. P means it's passed. The children who live in that house have been checked. They've got purple marks. We know they've been vaccinated. It was team 60, and they were walking that particular way. If it doesn't pass, there's a child missing, it gets an X written on. On some houses, you can see lots and lots of chalk marks. And if they're not vaccinated, you vaccinate them there and then. We're generally greeted very happily by people, but occasionally even polio Teddy fails. And here we have someone who wasn't too happy at being vaccinated by this horrible bearded man who forced his hand, their mouth open. And even though I gave them a present, they didn't particularly want to be vaccinated. Why do we go to India when they're polio-free? Well, firstly, we go because we want to ensure that what you see on the screen never, ever happens again anywhere else in the world. Someone who had polio as a child and is now in a hand-driven polio trike. But we also go to India because we made a promise as Rotarians in 1985 that we were going to eliminate polio from this world. And if we don't deliver that promise to the children of this world, where do we stand as Rotarians? We also go to India to ensure that Ruksha, who is the last case of polio in India in 2011, she's remembered as the last case of polio in India, and that her father, who bitterly regrets not getting her vaccinated because she was a bit of a sickly child, now is a great proponent of vaccination, and he goes around the Calcutta area talking about it. But also, she was the model for how we react if polio does pop up in some area of the world where they are polio-free, and in terms of the response mechanism that we actually put for it. So at the moment, we all wear these badges, End Polio Now, and it's almost well done us because we've got 22 cases of polio last year, and there have been cases of polio this year. And it'll only be a few years' time when it will say we will have badges that say polio ended now. And the reason why polio ended now is you, me, it's us, it's Rotary. Remember, it was our idea. Everybody else will pop up and say they thought of it, but Rotary in 1979 said, we will end polio now. We will ensure that the children of this world live in a polio-free world. And it will be the second human disease to be eradicated throughout the world. That, very, very quickly, is how you do a NID in India. Thank you, conference, very much for listening.